Through IP, I have learned that collaboration is kind of the best way to address the most difficult patients, and truly integrating the process between all of the disciplines has shown me that it can be much easier to bounce ideas off of everybody in every specialty.
Through this experience, I believe that collaboration and efficiency of the care team has greatly improved. Not only do we have several disciplines in the room with that patient at the point of care to address a multitude of issues, we have our instructors as well that are with us who can provide expert consult. And working together as a team, we can better learn to collaborate and appreciate each other's disciplines as being a member of that team.
So a lot of what we are trying to learn is how to provide behavioral health services in the fast-paced society of primary care settings. And so a lot of what I'm trying to learn through this interprofessional clinic is how behavioral health works in the medical field, because it is very different than what we are traditionally trained as mental health providers.
Through the IPE experience, communication has improved in several ways. I think one of the biggest ways is that within that first day we kind of all learned what each profession tends to focus on and the language each profession tends to use. So if I said a term that someone wasn't completely familiar with, like someone that's in bipolar, they're going through mania, it was a great opportunity for me to teach the nursing student what that actually meant. And when she's asking about physical symptoms, or when the pharmacist is talking about certain medications that the rest of us just have no clue what those are, it's been her opportunity to be able to teach all of us what those means. And during those processes, it kind of has allowed us to become more comfortable working with the other professionals and being able to understand kind of their perspectives and where they're coming from, which I think helps us in communication in general.
One of the great benefits of being a part of this experience with interprofessional education has been our exposure to other schools throughout UTSU. Some of the other programs I've been exposed to through this experience has been pharmacy, case management, and nutritional services. However, I would love to see other schools be involved, such as speech and language pathology, audiology, radiology, and physical therapy.
So part of this interprofessional clinic that I have learned is just how to collaborate with the physical side and still be able to provide a service that the patient desires and the one that they are satisfied with.
One patient that we were working with that was pretty difficult. There was a balance between some behavioral health issues. The individual was suffering from bipolar, and at the particular time was in a pretty manic state. But through my interview process, we discovered that she wasn't actually taking her medications. And so it was pretty cool to be able to talk to the pharmacy student and the nursing student to figure out that some of her physical side effects were actually a reaction to not taking the medication. She just immediately stopped taking them and didn't titrate off. So particularly between the three of us on that case, it was pretty cool to kind of find a balance between how we can get her back on certain medications, why she wasn't taking them in the first place, and how to address her physical symptoms that day.
I'd say the greatest educational benefit as being a part of this interprofessional educational experience would be it's really grown my confidence as being a member of the healthcare team. Also, I see the value of having all the other members being involved in the point of care for that patient.
One of the kind of coolest experiences that I had with the interprofessional clinic is just one of the first days that I was there, I didn't really know what to expect, and so I was just kind of introducing myself around, saying, hey, I'm a behavioral health provider, and I was so surprised how many of the other students from the other disciplines were like, I had no idea what you do. I've heard of behavioral health, but I had no idea what you really do here. And I was like, well, that's great, because I've heard of a lot of medical stuff, but when it comes to specific kind of medical diagnoses and what that actually does to the body, I'm like, I'm way over my head. And so it was just a really awesome learning experience just to really expose myself to the different fields and really learn what they can provide beyond what you learn about in TV or what you learn about just when you go to your own kind of doctor's visits.